In this episode of the Courageous Public Health Podcast, Brittaney Jenkins, founder and CEO of Jenkins Public Health Consulting, course and program strategist, and public health entrepreneur, shares how courage looks in real life, moving away from home, building a business from her expertise, and learning to name her value without apology. Brittaney also breaks down what it takes to protect your work in contract negotiations, treat confidence as a skill you can build, and lead with strong boundaries as a mother and a leader. You are listening to the Courageous Public Health Podcast, episode 43. To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode. Hello, and welcome to the Courageous Public Health Podcast. I'm Dr. Christy McClamrock, founder and CEO of Courageous Public Health. I created Courageous Public Health because women in this field are already doing extraordinarily courageous things inside systems that rarely support or name that labor. My work focuses on helping public health and health-related organizations strengthen courageous leadership among the women on their teams through workshops, facilitation, and strategic conversations that move people from fear-based decision-making to grounded, values-driven action. I'm so excited for you to hear today's interview. I'm going to read her bio and then we will get started. Brittaney Jenkins is a nationally certified health education specialist, public health practitioner, speaker, and career coach with over 15 years of experience in healthcare and public health. Inspired by a legacy of community service from her adoption and lived experiences that introduced her to philanthropy and fundraising, Brittaney founded Jenkins Public Health Consulting in 2018. Based in Alabama and serving clients globally, Jenkins Public Health Consulting is a woman and minority-owned firm helping nonprofit and for-profit organizations attract consistent funding by deploying highly effective programs, effective strategic partners, and rebuilding trust with communities to improve access to resources and health outcomes. Brittaney specializes in chronic disease and injury prevention initiatives and self-management programs with an emphasis on health equity and disparities. Recognized for her contributions to public health and healthcare, Brittaney has won and managed over $12 million in local, state, and federal funding, designed and implemented national-level health initiatives, and been awarded as Rising Star by the Alabama State Black Chamber of Commerce, featured by Marquee Who's Who for excellence in public health, and served in community-focused leadership roles, including chair of the Smoke-Free Indy Coalition and co-chair of the Toxicology Board at Vanderbilt Medical Center. Jenkins Public Health Consulting also has workforce development resources that help individuals around the globe land high-pay and fulfilling jobs in healthcare or public health. Are you ready to be inspired by some serious courage? Let's go. Hi, everybody. I'm here today with Brittaney Jenkins. Hello. How are you doing?
Hi, I'm well. Thank you so much. I'm actually happy it's Monday.
It's Monday and we're like getting on it. First thing here.
Yes.
It's great to have you. for our listeners, Brittaney and I have been connected on LinkedIn since 2022, and done a couple things together, but are very excited to finally be able to have I won't say it's not an in-person conversation, but it's like on Zoom kind of conversation, which we haven't done before.
Podcast in depth. An awesome conversation. Yes.
An awesome conversation. This is going to be a great conversation. So I want to start by asking you to please introduce yourself.
Absolutely. My name is Brittaney Jenkins. I am a founder, CEO, of Jenkins Public Health Consulting. I'm also a mother, a Christian, and a wife. We currently live in Phoenix, Arizona, but originally from Indiana. We have moved across the country and have enjoyed it. It's been a big part of our lifestyle. And I think me and my husband are like, I think we kind of like moving around, but we're going to be here for a while. As a founder and CEO of Jenkins Public Health Consulting, I actually help organizations design health programs and initiatives, help them with implementation, capacity building. We actually design online courses as well. And, me saying it's a great day on Monday because my client, they just hit their online course went live today. So super exciting day today for them and whoever that they serve. Yes, very exciting.
Fantastic. And congratulations to you.
Yes. And it's a good experience to build online courses and bringing the products to life and their programs just from being in person to online so you can expand your reach. That has been so fun. But we also make sure that we're reaching the community with these resources to improve access and health outcomes. And that's a little bit about me.
That's great. That is great. When you have a client who has a win, that is also your win. And I think that's, it's important to remember that.
Absolutely. It's been a journey for them. Technology and trying to stay ahead of all the changes in that, including AI, and making sure they're still having an authentic approach and giving outcomes or results for those that they're serving has been a big focus. And so just to see it come to life for them has been so fun and exciting.
That is fantastic. Well, we'll make sure that you get to share this episode with your client so that they can hear the shout out.
Absolutely. Yes, right.
Okay, so I think we should just jump right into our first question, which is about courage. So I like to remind our listeners about the difference between bravery and courage. So bravery is about taking action without fear, while courage is taking action despite fear. And, that fear, I often feel fear. So I'm often in the realm of courage rather than bravery. So I would love to hear from you about some experiences in your personal life and your professional life where you've acted courageously.
Yes. And I love what you said that, you feel fear, but I think a lot of it too is just hesitation. Yeah. Because you might actually be fearless, or more of us are actually fearless, but we might have more hesitation because we're planners. We want to see what is going to be the outcome before we even take the step. Will this be uncomfortable? Will it actually work? Will it get me to where I want to be? And so sometimes I think it's less fear, but more hesitation and clarity that's needed for why are you doing it in the first place? And how does that align with your long-term, dream for your life, right? I know we say long-term goals, strategic plans in the public health and healthcare space, but at the end of the day, how does this align with the overall piece and part of your life, right? The things that I'm doing in my life every day aligns with my family, my child, my business. This right here aligns with me. This is why we made it happen, right? I showed up here because it's actually meaningful to me. And so I want to say thank you for having me on your platform.
Thank you for also, you're so welcome. I'm so happy to have you here. And I actually really appreciate what you're saying, that sometimes it's not fear. Sometimes it's hesitation. Sometimes it's trepidation. It's maybe a little bit of a lack of confidence. So it's funny. I guess I think of fear in this broad sense, but overall, you're right. Yeah. You're right that it's, it doesn't always have to show up as fear. It might show up as something else, and we're still taking action. So thank you. I appreciate that. I appreciate that point.
Yeah. And to answer your question, how do I use some of my experiences, or what have I experienced, is number one, moving away from home. I love talking about this. First, I'm one of 10 siblings. I have 9 siblings. It's 10 of us all together. Wow. So a big family. Every time people come over to our house, whether it's friends from school or even my husband, it's like a party. So, I have a very large family, and when I left, it wasn't taken very well. I didn't know I was that special to them, but obviously I was, and still am.
Of course.
And so moving away from family, it was very scary at first. I had a plan. It worked out very well for my life, but I had to take that step. It took a lot of courage. It took a lot of me just understanding that I am an adult and I don't have to listen to what they're saying at this point, but I know that what I'm doing for myself right now is something that I'm doing out of courage to see what's possible for my life. And when I took that step with my husband, he was my fiance at the time, which caused a little bit more, hesitation from the family. We're 8 years married though.
Okay.
It was something that, I knew I could see something greater that aligned with the overall purpose of my life. So 6 years married, 8 years together. And it hasn't been anything I've ever regretted. And it's brought my family outside of their comfort zone to see me in the different environments that I've lived in. So it's been a big blessing for everyone at the end of the day.
Oh, that's beautiful.
Yes. And, I wanted to get away from Indiana, where I'm originally from, just for the weather purposes. It wasn't that I wasn't happy where I was. It was still a lot of job opportunities. I'm actually still serving all of my first employers and other employers as a consultant. But the weather was the biggest reason for me leaving. So,
I grew up in Michigan and now I live in the Bay Area. So I feel you.
Yeah. And I would say it is kind of breezy, in Arizona, Phoenix, Arizona. It is a little breezy because I guess I'm cold bodied, but, it's very nice outside.
Okay.
Yes. It's 66. It's been 66, which is still good for, a lot of my friends in the Midwest.
Yeah. Oh, yeah. Totally.
It's a great day.
That's great. Yeah. Moving away from home. I can imagine that would take a lot of courage, and, but it sounds like, the payoff. I love that there's actually a payoff for you and also a payoff for your family, which they probably weren't expecting.
Not at all.
To gain something by you leaving.
Absolutely. Because, when we don't get out of our comfort zone, or just the place that we know to be home, we don't see what the world is. Like me, I never lived in Phoenix, Arizona. I've never lived in Arizona in my life. But I knew that, first of all, I'm built differently. I've always been very outgoing. Maybe it's the family dynamic that I have. I'm very adventurous. I'm okay with change right then and there. So everyone isn't that. But I think if there's an opportunity for you to even experience it for a short time, maybe a visit, something to see more of the world. So yes, it has opened up doors for them, and I still go visit. We're planning a 2026 visit.
Nice. Hopefully not in the middle of winter.
No, summer.
Summer 2026. Beautiful. Yes. That's great.
Yeah, everyone comes to Phoenix this year.
Oh, go ahead.
At
Sorry.
this time of the year.
Say that again.
Everyone comes to Arizona at this time of the year. So September through May. And then maybe we go to Indiana May through September or something. I'm not sure. Because it gets extremely hot.
Yes. Oh, man. So I know that you have also been courageous in your business.
Yes.
Tell us about that.
Yeah. Starting a business wasn't something that was like, I need to do this, or I really have to do this. It was just wanting to help more people with the skill that I had, not even thinking of it to be a business. So starting a business took a lot of courage, because I had to first take myself seriously if I wanted to be perceived as serious and knowledgeable, and talk to people that didn't know me and who didn't know why they should do business with me. Right. And encourage them to, pay me for services.
Yeah.
So that took a lot of courage, because coming from the nonprofit space, nonprofit means to other people, or to a lot of people, free. But nonprofits are still a business. They should operate as such. And also it's okay to charge for services, right? So starting my business took a lot of courage to meet people and serve them. And it just built me for greater to this day. So 2018 when I started my business. And I haven't looked back since. I love what I do. It provides a lot of flexibility being a mom and a wife and traveling, being able to serve clients and people all over the world has been just nothing I could trade, my career for.
Yeah, it's really important to recognize the value that we have. Mm-hmm. That like we have value and our knowledge and our skills and just we are worth charging for. Like that's I know a lot of women who have struggled with that piece.
Yes.
Right? You start a business
Absolutely.
and then you have to say like, this is what my time is worth. Right.
Yes.
And
yes,
that can be hard to do because there are a lot of messages that say, oh no,
Yes.
we should
Absolutely.
not do that. I don't know. Yeah.
No, that's a big problem that I see. It's been interesting because as a health equity consultant, it's usually how I title myself when sending proposals.
Yeah.
We do so much more than that, right? For example, if I'm helping an organization design a course that they are going to charge for because we help them expand their revenue sources, right? Yeah. So that they're not solely depending on grants. We help them with their pricing. Why are we pricing it this way? Can we make it free and still be get revenue because maybe the user isn't paying. Right. Maybe someone else is paying, right? We talk about sponsorships. We talk about grants. There's so many different ways to let that price be free for the consumer, but there's also ways to still charge for it, whether it's $25 or $2,500 or $25,000.
Yeah,
it just has to make sense, and we also have to be ethical in our approach, which I think there's some ethical approaches to the use of AI generated content. So we talk about those things, and pricing again is one of the big things that people often struggle with. But once we break it down, it makes sense for them to still make a profit off of that experience.
Yeah. And then you also get to make a profit of everything you just said.
Yes, exactly. And that's why they that's why they have a return on their investment for investing in me, because it was so much more than building a course for their health program. Right.
Yes.
It was just so much deeper than that. And now it's recurring revenue for them while they're still serving, doing maybe a little bit more, but maybe even a little bit less. It depends on the way they design it. So,
right.
Yeah. Thank
that
you.
Makes a lot of sense. That makes a lot of sense. Mm-hmm. Yeah. So, do you have any other examples of courage that you wanted to share? And yeah,
for sure. I would say courage is the mom guilt that comes from all of this, right? The courage to put my child in childcare. Yeah. It takes a lot of courage. Number one, because she has food allergies and her life is literally in other people's hands, not just taking her to another environment, right?
Yeah.
She has serious food allergies. She was just retested a few days ago and had a very serious reaction still off a minimal dose. So she's okay if she doesn't eat dairy or nuts. She's a great eater. She would eat everything you give her. But that takes a lot of courage for me to not only place her there so I can still continue my mission behind my company to serve others, but also so that she can have those experiences that we have when we travel with my husband and family, just the different things that you need to do while you have your kid in school. So I have to have courage and say, it's okay. Get rid of the mom guilt. You are an amazing mother. You have a mission that's different than being a caregiver 24 hours a day, perhaps. I'm not sure how you say that differently, but my daughter still is loved by both of her parents. And it is okay that I want to pursue this as my main passion during the work hours. And then we have great time after school at the library.
Oh, yes. Beautiful. That's beautiful. I know when just before we hit record and when we were first on, you were saying that a neighbor had dropped off cookies? Dropped off some cookies.
Yeah. Actually, it was like a 4-foot tall chocolate bar and some cookies.
Oh, and you're like, this is not, you got to be vigilant. And that takes a lot. I can imagine that takes a lot.
Yes. It does, because I think people don't realize that allergies are a invisible complication, or invisible disability is what they say.
Yeah.
Because Gianna has been, hospitalized over this. She's had the paramedics at her school multiple times, not this location, thankfully, but also, at our home. So you just never know. And I think some people can take offense to it when we're saying, oh, no, thank you. Right. But I do take the time to explain and educate and rally people around, because now our neighbor knows that she has that food allergy, right? Their kids are old enough to know. So they'll be more intentional about not offering anything, hopefully. That's what we prefer. But,
like, of course you educate. This is public health, right? It's like
exactly
educating people about, food allergies and how to use an
EpiPen.
How to use an EpiPen.
Yes. Because even though it does seem very simple, maybe those who've ever been around an EpiPen, when you're dealing with a child, people are very scared to administer it. Gianna had an unfortunate situation at a previous location that they were afraid to give it to her, and it could have cost her life. And so I do take the time to be an educator. I am a certified health education specialist, and I'm very proud to be. And so I do have to always be mindful of who, my position, not even just as a parent, but as an educator. Trust them a little bit, educate them a little bit, and then add in where else I feel is necessary. Having some boundaries around that. But I did find myself educating a lot of child care professionals on the proper use of EpiPens and understanding anaphylaxis, which is different than just, a sneeze and a cough. So, and things can change very fast.
So it sounds like you get to be courageous when you trust other people to take care of your child.
Absolutely.
That sounds like that takes courage.
Immense courage. Yes. Like, my stomach just drops sometimes, but I'm like, she's okay. And a lot of the things I'm overthinking it, because you hope that everyone has your child's best intention, and we believe they do. So it's just be courageous, get done what you need to get done. And if you want to get her early, you can. It's not like she has to stay there all day.
That's right.
So sometimes it's a few hours.
You get your work done, you pick your kid up early. And you have extra time at the library. I love it.
Right. So much fun.
So much fun. So much fun. So, I really think it's important to think about courage in relation to being authentic and, claiming and expressing our power in our most authentic way. And, I think all of us find ourselves often in spaces where our authenticity and our courage are not necessarily welcome. So I wonder if you have some thoughts about how you express and embody courage, if you've faced any challenges with that and how you've navigated them.
Yes. Expressing courage, boundaries, all the things I have, especially being a female business owner, a Black woman in business, a mother in business, there's a lot of challenges of expressing, right? And so sometimes you have to position yourself to let people know that this is your company and your rules don't, like other people's rules don't apply to your company. And so you have to express that to set boundaries and standards for success in the company. And so I've had to, be assertive, which is different from aggressive.
Yes.
Towards the boundaries that we have set for the ultimate success of our company and clients. And, those are just some ways that we've had to, when it comes to contract negotiations with government agencies who want to, keep the contract. But I do believe that a lot of people don't understand the nuances of intellectual property, and that the contract is not just a contract. There are some negotiations in contract. And without that, we will be giving our intellectual property, our 5-step frameworks, our methods away at no cost. And that takes some courage to speak up for. It takes assertiveness to say, hey, that's our standard. We can't mend on that, but this is the additional price if you want to include it. So that has taken some growth over the years. But I think I've always been that assertive person. I think that's helped me get to where I am today. Still growing. And I'm also making sure not to teeter the line between assertive and aggressive, because I think there can be, there can be a thin line. But I think it's a powerful thing to have, as especially being a female who is typically underpaid in different positions that the male might have the same position for. Right.
Yep.
So,
yeah, I remember, I was probably, I don't know, in my 20s or something, becoming sort of conscious of the difference between assertive and aggressive. And so for all this, for the 30 years since then, I am always really, really careful to say what I mean. If I mean assertive, I say assertive. And if I mean aggressive, I say aggressive. I think that that's such an important distinction. And I also think that, as a woman, I often worry that I'm being too much when in fact, I'm probably still like way over on the other side.
Yes, I'm not being enough.
I'm not being enough, right? Like I worry that I'm
and
being
that's
too
a problem
much.
too, right?
Yeah. Yeah. It's like, what? You could be more and you would still not be in the land of aggressiveness. Like it's
right.
It's okay.
Or in the negative way of saying too much, right?
Right. In the negative, yeah.
Because absolutely. We have so much potential that we're not even tapping into.
Yeah.
And I do think it takes these types of conversations and even mentorship and coaching to help bring that out of you.
Yeah.
You have had so many accomplished leaders on your podcast. You are an accomplished leader. And so we see what's possible, and still I also see on my side of doing workforce development work as well, that candidates are just really not speaking up to their actual skill or at the confidence in the way that will convince a hiring team that they are the best candidate for a job. So it's like, it's already within you. You have to have courage to speak up for yourself and know that you're not doing too much when you say this. You're not cocky. You're confident. Right. Yeah. So
what's wrong with being confident, says Demi Lovato.
Right. Exactly.
And it's funny because I talk about how courage is contagious. I really do believe that it is. I think confidence is also contagious, right?
Yes.
Like, when we're confident, then other people are like, oh, that person is being confident. Maybe I can be more confident as well. Sometimes I don't even think it's a conscious thought, but it's like, I do think that we can
absolutely. It's mirroring.
It's mirroring.
Yes.
Yeah. And I think that's, we won't go down this rabbit trail. But I feel like that's part of what we need in public health is
absolutely.
We gotta all really tap into our courage and our confidence, particularly as women leaders. Like that's gotta be that's gotta be part of the solution here.
Yes, absolutely. And then it's like, how do we get to the level of confidence that we desire? Yeah. Right. And that's putting ourselves in experiences that's going to help us build our confidence, which confidence is a skill, I believe, to have to get you further onto where you want to be, right? You can be confident on your couch, but with that same energy, be confident on stage. Right? Yes. So putting yourself on stage which is something I also had to do to be more confident, because I have a big desire, and I have been a speaker for years, but I have a desire to be a stronger speaker. I joined Toastmasters years ago, but I still make mistakes when my speaking, and that's okay. We're not perfect, but my desire to be a keynote speaker, speak to large audiences and to more people in general about just the world of public health and the opportunities for organizations and individuals, I have to put myself out there more often and put myself in these types of spaces. Yeah. And so that takes courage. And if anyone out there is trying to build their skill in any way, think about what skill you're trying to build. Where can you build that? It's not just going to Coursera. It's not just, getting a job. Yeah. Mentorship can help you realize you already have those skills you thought you were missing, or you can be placed into an environment that can help you grow those skills at no cost, right? Yeah. Your job can pay for you to continue learning. Absolutely. And then there's just so many other ways.
There are so many ways. I'm so glad that that's something that you're, helping people understand. And be able to pursue. That's fantastic. Okay, so this definitely leads us into our our last question, which is about vision. Okay. And thinking about, your vision for public health and also your vision for yourself, your own personal vision for your company, maybe for your family, for your daughter. Yeah.
My vision just for public health, we'll start there, is I'm seeing a lot of health technology more and more as we begin to support them and bringing their technology to the community, is that they need to collaborate more with public health in the beginning because they might have an innovative tool, but they're also not program implementers. Mm-hmm. They're software, developers. I'm not a software developer. I can design an online course, but it takes no coding, right? Yeah. Some people who can do coding, they don't know how to build an online course. There's nuances to everything, but I do think we need more health tech and public health working together early in the stages so that when they go to implement their technology, whether it's within the hospital system, within the community, within an app, that it's equitable, that it's health literate, it's accessible to everyone, and just so many other things that can help them get to the outcome that they promised the user, and that the user can go tell other people about it as well. So that's my vision for where I see technology, AI, automation, working with public health. And then again, health tech that combines with healthcare. So yeah, that's one part. My vision for my family is to continue to grow. That's one of my visions for my family. I have 9 siblings. I don't want 9 children. That would take tons of courage. No.
Yes. Shout out to your mom.
Yeah, so that's what I see for my family for sure.
Okay, so somewhere between more than 1 and less than 10.
Yes,
is where you're going.
Yeah, because the funny thing is there, and I probably shouldn't even say this out loud, but this is a podcast, and it makes it more spicy, I guess you could say. But there's 10 sets of twins in my family. I guess that's not the spicy part, but that's really interesting. 10 sets of twins in my family. They run on both sides. And so, it's kind of funny how that's just been a family tradition. Yeah. Technically. My brother had twins. My sister had twins. My mother's a twin.
Wow. Wait, but were any of the 10 twins, any of your siblings twins?
Technically, I thought my oldest sister was a twin, but I'm not sure. Okay. We're not sure.
Yeah.
Yeah.
That's so interesting though.
Yeah. Yeah. So we love joking about that, the whole family thing. And yeah, I don't want to be the person, but if I am, that's okay too.
Yeah.
To carry on the tradition.
To carry on the tradition. Beautiful.
Yeah.
I love that so much.
Yes.
Well, I so appreciate you coming on today. It's been absolutely lovely to talk to you. I want to make sure that our listeners know how to connect with you. Yes. So what is the best way to do that?
Yes, please connect with me on YouTube. We're helping organizations get funding on repeat. That is kind of like what we say to keep people engaged, funding on repeat or consistent funding for their health programs and initiatives. LinkedIn is also where you'll find me most engaging, communicating, sharing resources.
Yeah.
We also have our community impact webinar that's coming up completely free to the community of health professionals to learn more about how you can use your program, your product, your services to impact community at the greatest level. And so I'm super excited about those things coming up and happening even throughout the month of December. So thank you so much for this time. And I will be connecting with you very soon.
Absolutely. And we'll put all of that information in our show notes. So it's really easy for people to connect and, they get to learn more about you and more about your courage.
Absolutely.
And more about your confidence. And,
Thank you so much.
Keep spreading it around here.
Absolutely. Thank you so much. This has been so good.
Thank you so much. Sometimes courage is moving away from home to build a life that fits who you are becoming. Sometimes courage is starting a business and asking people to pay you for the value you bring. Sometimes courage is trusting others with what matters most, including your child, so you can keep showing up for your purpose. Brittaney Jenkins reminds us that courage is not about having less to lose. It's about choosing alignment even when the stakes are high. If this conversation made you think about the women on your team, in your organization, or your own leadership, this is exactly the work we do through Courageous Public Health. We partner with organizations to offer facilitated, interactive, virtual workshops for women leaders in public health, turning courage into a leadership skill so it becomes an organizational strength. Because in today's public health landscape, fear-based leadership costs organizations staff retention, community trust, and their ability to respond when it matters most. If you're interested, please reach out. Links to connect with us are in the show notes. Until our next episode, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.